In this video, we are going to be looking at the peritoneum. Our aim is to explore the peritoneum and address interperitoneal, retroperitoneal, and secondarily retroperitoneal organs. This will help you with your learning objective to describe the peritoneal cavity and the formation of the greater and lesser omentum. So what is the peritoneal cavity? Well, in the same manner that we have the pleural cavities within the pulmonary cavities and the pericardial cavity within the mediastinum, we also have the peritoneal cavity, but this one lies within the abdomen. The same tissue that lines the pleural cavity and the pericardial cavity is found within the peritoneal cavity. This serous membrane is made from a tissue called mesothelium that is derived from the embryonic mesoderm. The peritoneal cavity is filled with approximately 50 ml of peritoneal fluid. As all the organs of the abdominal cavity are highly mobile, this fluid helps to reduce friction and prevent the organs from sticking together. It is easy to misunderstand the term peritoneal cavity. The peritoneal cavity and the abdominal cavity are not synonymous. This can be a difficult concept to understand. So let's have a look at this model that I have created in order to be able to demonstrate how the peritoneal cavity works. Imagine this blue shape is a balloon, and we have the walls of the balloon, and the balloon is filled with fluid. To the left of this balloon, we have a black ball. Let's pretend that this ball is an abdominal organ. If we push this ball towards the balloon, we can see that the balloon envelops the ball. The ball is not inside the balloon, but encased in it. To the left of this final picture of our model, we can see that there are two layers of balloon wall, and we can see that the balloon wall lies immediately to the circumference of our organ. An additional balloon wall forms at the perimeter of the whole model. This model represents how some organs sit within the peritoneal cavity. The wall is the peritoneum, and the peritoneal cavity is filled with peritoneal fluid. On the left side, we have two layers of peritoneum. Our ball is now considered an interperitoneal organ. Unfortunately, it's not quite as simple as that. I have changed the colours of some of the structures of this peritoneal cavity. The external wall of the cavity remains blue and is now called the parietal peritoneum, whilst the peritoneum that wraps around the organ is in orange, has acquired a different name. This is called visceral peritoneum. The peritoneal cavity remains unchanged, and as in this case does the intraperitoneal organ. However, the double-walled layer of peritoneum that now looks like a stalk is termed mesentery. I have swapped out our original ball and balloon model for this simplified transverse slice of the abdominal cavity, so we can see how this is applied in the real world. Our two types of peritoneum are visible. We have the blue outer wall that lies the abdominal cavity, and we have this visceral peritoneum that wraps around the intraperitoneal organ. The peritoneal cavity is represented by this large blue expanse. However, in this image, please bear in mind this is not representative of the scale of the peritoneal cavity. As I have already mentioned, the entire peritoneal cavity only contains 50 ml of fluid. We can see this intraperitoneal organ here, which we can probably assume is some small intestine. And this pink double-walled stalk here is the mesentery. On this side-by-side image, we can see the labelled diagram on the left of the transverse slice we have previously looked at. But on the right, we have a sagittal perspective, so we can appreciate the three-dimensional aspect of the peritoneal cavity. We have the parietal peritoneum, the mesentery, intraperitoneal organs, visceral peritoneum, and the peritoneal cavity as a whole containing peritoneal fluid. So let's briefly go back to our simplified balloon ball model. If I zoom in, we can see the mesentery, and we can see the structures that move through this double-walled peritoneum. The double-walled properties of the mesentery allow for veins, arteries, nerves, and lymphatics to reach the intraperitoneal organ. So far, we have looked at two simplified diagrams. This sketch is more akin to what we'd find in person. Let's orient ourselves with the organs of the abdominal cavity from this sagittal perspective. We have the liver, the pancreas, stomach, duodenum, transverse colon, and finally the small intestine. Now that we have oriented ourselves by identifying some of the abdominal organs, we need to take into account the properties of the peritoneum that can have clinical implications. Reverting back to this sagittal section, we can see that the peritoneum is a story of two tales. The peritoneum is divided topographically by the formation of mesenteries. This mesentery here has produced a small pocket that is separate from the larger pocket as indicated in purple. This small pocket is called the lesser sac, or the omental bursa, whereas anterior to this, the lining of the rest of the abdominal cavity is the greater sac. If I just zoom in, we can see that this mesentery that divides the lesser sac, or omental bursa, from the greater sac is called the lesser omentum. Now, this doesn't completely isolate the lesser sac from the greater sac, because there is an opening into the lesser sac on the right-hand side from an anterior perspective, through a hole called the epiploic foramen. We can see on this diagram that the epiploic foramen allows passage into the omental bursa behind the portal triad. This anatomical landmark is often exploited during surgery to the liver and control of massive hepatic bleeds. Given that we have a lesser omentum, it stands to reason that we are going to have a greater omentum. The greater omentum is found from the mesenteries that hang from the stomach, that then folds back on itself. So we have 4 layers of peritoneum that form this large apron-like structure that hangs deep to the wall of the abdomen. This anatomical structure has a large blood supply within it, and it is known as the nursemaid of the abdomen. This is because this highly mobile structure tends to migrate to pockets of infection, and indeed, when the abdomen is opened to search for infection, the greater omentum is often found around diseased tissue. In fact, the nursemaid properties of this tissue is exploited by surgeons, and sometimes the surgeon folds the greater omentum into the thoracic cavity after having performed open heart surgery. Now that we have a better understanding of the peritoneal cavity, we need to address intraperitoneal, retroperitoneal, and secondarily retroperitoneal organs. Intraperitoneal organs, as we have looked at during this tutorial, are classified intraperitoneal because they meet the 3 criteria. They all have a mesentery, therefore they are all highly mobile, and they are completely encased with visceral peritoneum. Opposite to intraperitoneal organs, we have retroperitoneal organs. These organs have peritoneum on their anterior side only. They do not have a mesentery, and they are firmly fixed between the parietal peritoneum and the abdominal wall. These organs are minimally mobile, unlike their intraperitoneal counterparts. Lastly, we have a midway point. These are termed secondarily retroperitoneal organs. These organs developed as intraperitoneal organs, but have adhered to the posterior wall of the abdomen during their growth. They are largely immobile, but can easily be separated from the posterior wall, such as during surgery, where they are only visible after accessing the peritoneal cavity. To summarise, the peritoneal cavity is constructed of a mesothelium wall termed peritoneum, and it is filled with peritoneal fluid. Parietal peritoneum lines the internal wall of the abdominal cavity, and visceral peritoneum lies across the organs of the abdomen. A mesentery is a double wall of peritoneum that has folded around the abdominal organ. The lesser omentum is a mesentery that divides the peritoneal cavity into the lesser sac and greater sac. The communicating hole between the lesser and greater sac is called the epiploic foramen. The greater omentum is the nursemaid of the abdominal cavity because of its ability to migrate to sites of infection. Intraperitoneal organs have a mesentery. Retroperitoneal organs lie between the parietal peritoneum and the posterior abdominal wall. And finally, secondarily retroperitoneal organs develop embryonically as intraperitoneal organs, but then adhere to the posterior wall during growth.